I want those labs rushed, do you hear me? And I want them to be monitored at all times. This is not happening again.
Of course. Right away, Doctor. Oh, by the way, they seem to be awake.
Ugh. Oh, thank goodness. Hey, look at me. Look at me. It's okay. It's okay. You're going to be okay. Do you hear me? Nod if you understand what I'm saying. Good. It's okay. I've got you. Do you hear me? Just keep breathing, just like that. Don't try to take the mask off, okay? You really need this. Just keep breathing, you understand me? Take a deep breath in. That's it. Very good. Let it out. Slowly. There you go. I know it hurts. I know that it hurts so much. And it probably started hurting really badly before all of this happened, didn't it? That's what I was afraid of. Don't worry, though. We're going to be monitoring you closely now. Far more closely than we were before. We've administered some medication to help with the pain. It should be kicking in soon, don't worry. What's happening? I wish that I had better news. No, goodness, no. As far as we can tell, you're not dying. No, I'm so sorry. That is not what I meant at all. You're not dying. You're going to be just fine, as far as we can tell. The only issue is we really don't know what's causing this yet. At first, it seemed to be a simple case of stress taking a toll on your physical health. That seemed to be the only thing that was going on, and then all of a sudden, I was paged here, and they told me that your rhythm had changed, and you passed out, and we couldn't get your heart rate to slow down. In fact, we had to administer some medication that, and this is going to sound really scary, but I promise you, you're fine now. For the time being, you are just fine. The medication did not do anything to harm you. But it did briefly stop your heart so that your heart rate could return to normal. Or at the very least, closer to normal. We were able to get you to come to, and now we have you on a high flow of oxygen. That should help. No, your brain function is fine. It only has stopped your heart for about 5 seconds. The oxygen mask is just to be safe. Even though it wasn't long enough to cause any serious damage, your brain was still deprived of oxygen briefly, so we're just trying to keep that from worsening. Well, it's good to see that it didn't do any damage to your sense of humor. Yes, I suppose now, after all that time spent watching medical dramas, your life has sort of turned into one. That was a good one. That was definitely a good one. Yes, of course, you can ask me anything. Oh, I thought that you meant you wanted to ask about what's happening with you, or what's going to, the test that we need to run. I thought, you had a question about your condition. I didn't think you were going to ask about that. No, we can talk about that. I cleared the case that came into the ER. It's nothing that I would be able to help with based on my specialty. So I can stay and talk with you about that if you want. I mean, from the look of it, your rhythm is getting a bit steadier. It's getting a bit calmer. So if talking about this will help with that, I'm definitely alright with that. What exactly do you want to discuss in regards to that? No, I definitely did not say no. I told you that, I wasn't saying no. I explicitly said that what I said wasn't no. And if I recall properly, before I was paged to the ER, I told you that I just needed to figure out a way to accept that invitation without making a complete fool of myself, which, well, I don't think there's any way for me to do that now. After all, you probably just heard me panicking and freaking out about possibly losing you because, well, okay, I won't lie. You remember what I told you about my anxiety? Yes, it does make me better at diagnosing certain things. However, I tend to get very attached to my patients, and of course that isn't a bad thing. In fact, if it motivates me to help keep people alive even more than I already was, then that's a pretty damn good thing. However, that also means that when I have to run a code, I tend to get very, very panicky. And in your case, I was screaming. I was screaming and on the verge of having an anxiety attack over it. However, I was able to push it down because I knew that if I panicked in that moment, if I let everything just start affecting me like that, I was going to lose you. And I did not want that. I would never want to lose any of my patients. Especially you. Especially not after what you said to me. After you were so scared just being here, and then you told me that. I didn't want you to die scared and anxious about something that you said. I didn't want you to think that you were being rejected. I didn't want you to die with those feelings. I wouldn't want you to die at all, obviously, but with those feelings especially, I'm getting a bit morbid, aren't I? I am so sorry. Anyway, the point is, I was panicking and I didn't want to lose you because I was coming back here to say yes. Yes, I do. I do want to go out with you. Assuming, of course, that you still want to, and assuming, of course, we're able to get you out of here fairly soon, which that does seem a bit unrealistic now, while we're still figuring out what's going on. Speaking of which, hold on a second.
Here are the labs you asked for, Doctor. They had just finished them when I got down there.
Wonderful. Thank you.
No problem.
Let me see here. Oh. Oh my god. No. That was good. Oh my god. That was relief. You just saw that was pure, unbridled relief. Oh, thank goodness. Thank fucking goodness. Well, at the very least, I can say that we were partially correct in our initial assumption. It is sort of a result of stress. However, according to these labs, you have a minor arrhythmia. And when you got this stressed, when your heart was racing uncontrollably, combined with the arrhythmia, it was placing a lot of strain on your heart. That was why you were in so much pain. And as this continued, the pain worsened because your heart was getting increasingly more strained. Exactly. Like working a muscle too long, even when it's hurting. The longer you do it, the more pain it causes. The answer to that question is why I was so relieved, actually. It is a fairly simple treatment. Well, the first option is we can treat it with medication. If it continues, or if it gets worse, then we might need to discuss surgery or an implanted device. However, the first step is going to be medication in your case. And since you've gone your whole life without this ever being a problem, I'm very hopeful that the medication will be successful. In addition, we might want to look at an anti-anxiety medication if you're not already on one, or a stronger one if you are. Or maybe a different medication altogether. We'll look into it based off of what you seem to need. But the point is, you're going to be just fine. This is something that we can easily treat. It is, of course, going to require some monitoring, and there is a chance that something like this will happen again. But compared to what it could have been, this is a relief. This is something that is very good. Very, very good. And I know, based on what you told me, you certainly weren't expecting that, were you? You were worried that it could have been a heart attack or something worse. Yeah. Consulting the internet can be both a blessing and a curse. Sometimes it can tell you that, oh, that rash is just poison ivy. But sometimes it can tell you, oh, that headache, that means that you've got a tumor and you're going to be dead in 3 months. It really, really depends on the keywords that you use and the symptoms that you're aware of. And there are just so many things that people can't monitor or check in their own homes, so they tend to go to the worst possible option and assume that that's what's going on. Yeah, that is probably why so many people are so scared in doctors' offices. They're worried that if they come to us with a problem, we're going to confirm that it is the worst case scenario that they were imagining. Yeah, I was worried about that too. I was, but based on your symptoms, I was able to confirm that that fear was unfounded. You were not having a heart attack. And you have no idea how much this relieves me. True, I suppose. It must be an even greater relief to you. After all, you were the one thinking that you were going to die. So that is certainly a great relief, I can imagine. In light of all that, I've never tried to segue from a diagnosis to a dinner invitation, but I suppose there's a first time for everything, huh? And since you were asking about it, this does seem like an appropriate time to mention it. I'm free next Wednesday. We can go out someplace, or if you want, you can come to my place and I can cook for you. I don't get to cook a whole lot since my hours tend to be a bit crazy, but whatever you want. Whatever would make you feel more relaxed and comfortable on the date, because I do not want this happening again. I do not want this happening again, and I certainly do not want to be the cause of it. So, just let me know. Think about it. And let me know when I come back with a list of some medications that we can try, okay? Okay.